If chronic sinus infections are affecting how you breathe and sleep, well, there is a permanent treatment that promises to help.
And is it affecting your spouse as well? A lot of people in this situation. Here with details on the balloon sinuplasty procedure, Dr. Michael Kaplan with Kaplan Sinus Relief, along with his patients Adam and Theresa Clanton. Welcome to the show. Husband and wife duo, by the way.
Husband and wife
we
duo.
should mention. And I don't know, do people credit you, Dr. Kaplan, with saving their marriages? Fixing the snoring problems?
This is one of many, actually, yes, because breathing better also enhances sleep and in many instances can reduce snoring.
And we love having you on the show because this is something that so many Houstonians can identify with, especially this time of year. People are stuffed up, they're having respiratory issues, and they think, oh, well, it's just Houston, right? It's just normal, but it's not normal, right?
The Houston crud can be treated. And especially as we enter into the spring months when all that tree pollen's about to accumulate on the hoods of your cars, there is treatment. You don't need to live without congestion and pressure and headaches every day. There are other options.
And I feel like people go through the motions and all of a sudden it's like 20 years. Let's get to the power couple, the Clantons.
Yes.
And Adam and Theresa. So, Theresa, what was it like before Adam had the surgery?
I mean, I was finding myself sleeping on the couch and like shoving him in the middle of the night, and then he wouldn't wake up, and then it would get louder and louder, and every night. So then I would be on the couch, and I'd be angry and more volatile, I think, during our marriage because I wasn't getting the sleep that I needed, and he had no clue. He had no
right,
clue.
because it's like, I'm not snoring, and you're like, no, you are snoring.
I was more angry, I think, because of the snoring.
And I was trying to sleep over there.
Right. You're like, what's wrong with you? Why do you keep poking me? So you went in for your consultation, and then what?
Well, yeah, the first time actually the prospect of talking to Kaplan was, Dr. Kaplan was brought up. She was like, oh, yes, go, call right away, and went in there, talked to him. They put you right at ease, tell you about what's going to happen. That's the best part about it. He educates you on it and makes it a little less scary for these sorts of things. But once you realize that it's going to work and it's going to do the trick and it's going to make her happy, everybody's happy, because when mama's happy, everybody's happy.
Happy wife, happy life. Yes, girl.
Did you really not realize you were snoring so loudly?
Sometimes I catch myself. Everybody's different. But when I really would realize is when I would get a slug right in the arm.
Well, and he started waking up in the morning, and he would say, I don't feel good. I feel like I didn't sleep really good. And I was like, you slept all night. I slept downstairs. Or I would even sleep on the floor in our baby's nursery sometimes just to get out of it. So he had no clue. He just knew he felt tired. He didn't feel really well. And, I was the one not getting sleep, and he was getting sleep. So
here's the thing. On this Valentine's Day weekend, couples can get back into the same room. The snoring can stop. This is all in office too.
It's all in the office. Takes 15 or 20 minutes. I even have the option of putting you to sleep with a little IV. You don't feel anything. You don't remember anything. Within a week, you're breathing better. Within 2 or 3 weeks, you're consistently breathing better than you have in years.
And this is specifically the balloon sinuplasty procedure. Walk us through the steps, doctor, because 20 minutes, that sounds like a very short amount of time to have such life-changing results.
Sure. Imagine you have an hourglass. Kind of like, the sinus is right here and it drains a little channel into the nose. I can dilate that channel.
To make it bigger.
To make it bigger. There are little valves in the nose called turbinates, and air flows under these turbinates. And by reducing these in size, I can make this turbinate maybe half the size within a week or two with a 15 or 20-minute procedure. And if anything, you feel some pressure, and that's about it.
And then you're done.
Yeah.
And also you get a cell phone number, don't you?
Yes, you do. All of my patients I operate on, they get my personal cell phone number, as you do. I think I'm still a contact.
Text all the time.
Breathing great over here, sleeping great.
But
you were taking allergy medicine and stuff before this, like 365 days a year.
Zyrtec D, all the usual.
it was like part of his morning routine.
Right.
Spray, the pills, and I mean, nothing was fixing it. He was just, temporarily masking the issue.
Yep.
What about now? Are you still taking those medications?
Occasionally for seasonal allergies, but it's not like it was before. And like I mean, the amount of time that you were talking about with the procedure, like you're in on a Friday morning like I was back to work on a Monday morning.
Like it never even happened.
And there's some recovery, but it's nothing like, it's the weekend to get it basically
It's
done with.
also so interesting too in a couple's scenario, right? Because it's interesting hearing you guys say that it was always you, Theresa, like really hitting him and letting him know that he was snoring.
Yeah.
How common is this, doctor, for you to hear from patients that they didn't realize the reason behind why they were tired and why they were tossing and turning all night long?
It's actually more common than you think. I even had one or two spouses, a couple of spouses, call me because they were concerned that their significant other who had the procedure, they weren't making the sounds at night. They weren't moving around at night.
Is he alive?
There was a
Check the
problem.
breathing.
I said, no, you breathe. They're breathing what they're supposed to be breathing.
What is so great and minimally invasive, it's done in the office, which is so great. And also most insurance companies will cover this as well.
The vast majority of insurance companies cover it, even Medicare, and we try to make it a seamless, easy approach going through it from the procedure itself to the payment. We want to make it work for you. It's very easy.
Okay, 15 minutes. I've got 15 minutes for that. So how does it work? Someone would call your office and say, hey, I think I have a problem, set up a consultation?
I'll tell you what you're not going to have. You're not going to have a wait of a week or two. You call my office, you want to come to see me, I'll get you in within 24, 48 hours, easily.
Fantastic.
True story.
And you're living well now, right? Aren't you?
Absolutely. She only punches me once a week now.
Just for random occasions.
Right,
Remind me
exactly.
she's there. A little love tap.
Well, great to see you guys. By the way, to schedule an appointment to see Dr. Kaplan, all you need to do is call this number, 713-766-0204, or just go to the website, kaplansinusrelief.com.
And for Valentine's Day, you can all just sleep through the night.
We're just going to lay in bed and just sleep. That's
Yes,
exactly
no
what
snoring.
Silence. Thanks to you all. Thanks for coming by.